me patiently no on this one kay medyo our discussion will be um medyo dragging siya daan no and just stay there. Basta lang kamuda. Okay? Sige. So if you have any questions, kindly write it down na sa chat na area. I will answer them hopefully after. Tapos wanta siya tanan. And then that's the time I'll be answering all of your questions. Thank you. Okay, so the objective of our class no for this session for you to be able to understand basic concepts and essentials of documentation and taking into consideration ethical and legal aspects. Okay, always remember that our documentation is a legal document. Okay, PT, our initial evaluation, no, our progress notes, all of those are legal documents. Okay, so understand the process of clinical reasoning to patient documentation on a hypothetical patient. Okay, you will be having this one no, a lot. Okay, when you reach some of the parts of the SOAP note. Okay, and discuss the parts of the SOAP note. List patient general information, no, amo to siya ginaang demographic information in an organized manner guided by the SOAP format. Okay, and this one, you will be having this one on your worksheets. Okay, guys, this is a recall lang man, no? I know, familiar na kamo with some of the medical terminologies, di ba la? Okay, so recall basic concepts and principles of the ICF framework used, no, as a conceptual framework and evidence-based practice for patient documentation. So the use of ICF no, during documentation that will serve as our guide no, in our thought processes no, in how we think on what type of questions we'll be asking no, to our patients. So we won't be focusing on the model itself but on the framework lang no. Reflect ang ICF sa ato na IE no kay because one of the main reasons there is that ICF no is a guide or is a tool okay wherein na pwede mo siya maging wherein the focus there is more on the functional outcomes no di ba with ICF we see the patient not as a disability okay nan. So recall medical terminologies and abbreviations used in the patient documentation. So your worksheet now will be the one to do this. Okay. Okay. So physical therapy documentation. So documentation, excuse me, is an important part of the care given to every patient. Okay. Why do you think so? Why do you think that is one of the important no, part of patient care? Can you hear from the class? What do you understand about documentation? And why is it an important aspect no, of patient care? Anyone from the class?
Hello, Miss.
Yes, go lang. Yes? Sino to? Brian, ikaw to?
Brian, Miss.
Okay, sige. Okay.
Yes, Miss.
Brian.
Ang importance, Miss, documentation is that na this is a document where not only you will use, but other PTs and other healthcare professionals will give preference before they, let's say, initiate an intervention sa ila.
Okay.
And though it is the record kung all about the patient that is essential for the whole process na sa let's say hospital.
Okay, very good. Yes, Brian. No? So documentation basically it actually talks about the patient, no? Kung ang patient mo nag-respond siya to all of your treatments, no? Or what treatments will you give to the patient, what intervention. Okay, this is also the a form of communication, no, 'di ba? So very important siya na communication na tool, no? Not only to physical therapists but to any other healthcare professionals nga under sa care no sang amo na nga patient. Of course, ang bottom line there is for the patient to benefit, no, and of course ang patient mag-improve ang iyang quality of life no out of all the interventions, no, out of all the assessment that the patient have undergone no through undergone no by the healthcare professionals nga naghatag sa iya sang different assessments and treatments. Okay, so it's a communication tool. Okay, and of course, no, ang main purpose kids and documentation as well is to improve patient, to show progress man no, sa patient or nag-respond siya or wala no, to any other treatments. Okay, so aside from that, the purposes of documentation as well would also dwell on patient record, know what the therapist does to manage the individual's patient case. No, it is also the rights no, of the patients and of course the right of the therapists. Okay, and this is considered to be a legal document, so please take this documentation very seriously if you really wanted to work as a physical therapist. And I know na some of you here will also become physicians, no? Okay, so you this one is a very serious and very legal na thing, okay, to dwell on. Okay, so there, no, it's considered to be a legal na document. Okay, so documentation provides consistency, no, and coordination among the services provided by different healthcare professionals because you are not only the one that will read no ang amo ni nga document, no, your IEs, no, your progress notes, hindi lang ikaw na sorry, na PT, no, ang mabasa sina, but it will be shared, no, it will be communicated to other healthcare professionals. Okay, obviously, hindi lang ikaw ang magiging healthcare provider on a single na patient. Okay, damo na siya ging adyan before siya nagkadto sa PT. Okay, so good documentation as well is a method, no, again, no, of communicating with all other healthcare professionals. So this is where, no, we write no the results no of examination, no our evaluation, our PT diagnosis, no, and the patient's prognosis. Okay, and also this is where we also write our expected outcomes. Okay, and our anticipated goals, no, goals natin sa patient and the intervention plan. Okay. And also, documentation will serve no as a basis no for reimbursement. For example, kung may mga insurances sila or may mga third-party payers no ang ato ng mga patients, no, kay a health insurance agency will not reimburse any no amount to the patient no kung wala ang patient naga-improve to the PT services. Okay, so very important na siya to other patients na may mga third-party payers, most especially if you wanted to work abroad, no? So very particular sila with documentation. So you can actually get sued, no, if wala mo if you can actually get sued, no, if lain ang ginabutang mo sa imo nga document, no, sa imo nga IE, no, ino-post no kung ano ang gakatabo sa patient, do mga amo na siya. Example. Okay, so third-party payers make decisions about reimbursement based on the therapy notes. Okay, so we should be advocate for this, no, so dapat we should help assist, no, we should assist our patients. Okay, So these decisions can be greatly influenced by the quality and the completeness of the note. Okay. So as much as possible, we want to have a note that is very comprehensive and relevant with siya to the patient. Okay. And then within the facility, let's say kung diin ka man yung facility, you wanted to work no later on, either in a nursing home facility, skilled na facility, all of the charts or all of the patient documents or charts are being reviewed. Okay, so dira nakasalalay ang discharge sang imo nga patient, no? Kung i-discharge na siya or ma-continue pa siya with further interventions, no? So discharge or further intervention decisions are made based in part on the documentation written by the healthcare professionals. Good documentation helps the therapist document as well his or her thought processes involved in the patient care. Amo na gani hambal ta earlier na this is the aspect of our practice wherein you really need to showcase your clinical reasoning skills. Okay? So tanan nga ginabutang mo dira